behavioral therapy works for people not just with autism, but for a variety of kinds of learning problems and psychiatric disorders. It's been a long time that we've known that behavioral interventions can be helpful to children with autism, and it's fascinating to me how much flexibility, the question of how much flexibility there is when we can get as early to the onset of the symptoms as possible.
Although you met a lot of skepticism before.
There's always a lot of skepticism, particularly in Europe, I think. But it's important to have skepticism. You know, we're researchers and we're tackling an important question, and we want to do it. The skeptical point of view is the useful point of view in terms of making sure that our studies are adequately controlled, adequately planned, and that we're addressing all of the problems involved in them. We've shown that children who receive a number of different kinds of behavioral interventions improve compared to very well done comparison groups. And yes, I'm not the first, I'm just one of many. I feel that the outcomes about normalizing children's learning skills and language skills are among the most important outcomes. And people often wonder why I don't talk about autism symptoms in that way, why I focus on the learning skills. But I feel like I always hold in mind the idea that autism is a disability. It's not a number on a test. It's a profound disability in everyday function. And when children are showing that they can perform well on every kind of measure, in school, in social life, in language abilities, in their learning rates, then it's clear that they are not impaired children. And if they're not impaired, then they don't, by definition, have an autism spectrum disorder. They may have some quirks, they may have some individual characteristics, but it's the disability the impairment that I'm trying to tackle here. And I think the children are showing this, that it is possible for many of them to be able to end up without significant impairment by the time they're school age. Our sense was that if the children could just learn to interact with other people, all the rest of this would fall away, and that they would then be adequate learners and start to speak. But I think study after study has demonstrated that that's not in fact true, that it isn't enough just to get them smiling and looking at us, that they have real learning deficits, and their developmental scores all show that. It isn't just about avoidance. It's really about not being able to do the things that other children do and to have significant deceleration in their learning rates. And if we can't address that, we cannot help them create best outcomes. I'm very happy to look at the language outcomes that we've created. You know, I came into this work knowing it, fully expecting that only half of children with autism would ever be able to learn to speak. And it was many years ago that we set a goal of 90%, hoping, wondering, it was like magical, pie in the sky, could we ever hit 90%? And then when we did, it was like, oh my gosh, it's really true. Most of these children really can learn to speak. And it changes forever your treatment. Once you assume that this kind of outcome is possible, it changes your treatment.